What's new from Apple? There's the new iPhone 16 Pro, built for Apple Intelligence. And it comes with the all-new camera control, giving you an easier way to quickly access your camera tools. The new Apple Watch Series 10 has our biggest display and our thinnest design ever. And this? It's the sound of active noise cancellation, now available on one of 2 new AirPods 4 models. So quiet. Check out all of the new products and new features at apple.com. You can even buy yourself something new. See apple.com for product availability updates. Apple Intelligence coming this fall.
This is what you do when you've just found that statement handbag on eBay and you want to build an entire wardrobe around it. You start selling to keep buying. Yep, on eBay. Over that all-black everything phase? List it and buy all the color. Feeling more vintage than ever? It's out with the new and in with the pre-loved. Next thing you know, you've refreshed your wardrobe basically without spending a dime. Yeah, eBay, the place to buy and sell new, pre-loved, vintage, and rare fashion.
Earning your degree online doesn't mean you have to go about it alone. At Capella University, we're here to support you when you're ready. From enrollment counselors who get to know you and your goals, to academic coaches who can help you form a plan to stay on track. We care about your success and are dedicated to helping you pursue your goals. Going back to school is a big step, but having support at every step of your academic journey can make a big difference. Imagine your future differently at capella.edu.
Where does the computer mouse like to hang out? At the scroll bar. Your dad is so strong, when The Rock maxes his bench press, he asks your dad to spot him. Why did the cat cross the road? Who knows why a cat does anything, honestly?
If you just read the bio for Dr. Steve, host of Weird Medicine on Sirius XM 103 and made popular by 2 really comedy shows, Opie and Anthony and Ron and Fez, you would have thought that this guy was a bit of, a clown.
Why can't you give me the respect that I'm entitled to?
I've got diphtheria crushing my esophagus. I've got Ebola virus dripping from my nose. I've got the leprosy of the heart valves, exacerbating my incredible woes. I want to take my brain out and blast it with the wave, an ultrasonic, echographic, and a pulsating shave. I want a magic pill for all my ailments, the health equivalent of Citizen Kane. And if I don't get it now in the tablet, I think I'm doomed and I'll have to go insane. I want a requiem for my disease, so I'm paging Dr. Steve. Dr. Steve!
From the world-famous Cardiff Electric Network studios, it's Weird Medicine, the first and still only uncensored medical show in the history of broadcast radio, now a podcast. Been a podcast. Why do I keep saying that? I'm Dr. Steve with my little pal, Tacie, my partner in all things. Hello, Tacie. And my other little pal, P.A. Lydia.
Hello.
Back from sabbatical. Yes. This is a new show for people who had never, not a new show, well, this is a new episode for people who had never listened to a medical show on the radio or the internet. By the way, I'm operating on 3 hours of sleep. We'll talk about that in a second. If you have a question that you're embarrassed to take your regular medical provider, if you can't find an answer anywhere else, give us a call, 347-766-4323. That's 347-POOHEAD. Follow us on Twitter at Weird Medicine or at DrScottWM. Visit our website at drsteve.com for podcasts, medical news, and stuff you can buy. Most importantly, we are not your medical providers. Take everything you hear with a grain of salt. Don't act on anything you hear on this show without talking it over with your healthcare provider. All right, very good. Check out stuff.drsteve.com. Please use that whenever you do shopping online. It really helps to keep the servers going. And you can scroll down and see roadie.drsteve.com. Roadie, R-O-A-D-I-E, .drsteve.com is the robotic guitar tuner, and you can get one for bass too. It's a great gift for anybody that has a stringed instrument. And they also now have the Roadie Coach that will actually teach you how to play your instrument. So if you bought a ukulele and you don't know how to play the damn thing, the roadie coach will show you how to do it. It's not that expensive. It's pretty cool. Check out Tennessee Hot Sauce Company. That's tnhotsauceco.com, or just Google Tennessee Hot Sauce Company. They sent us a bunch of hot sauce, and they're pretty amazing. And they even said, do you want to do a weird medicine one? I said, yeah. Can you ferment Tabasco and ghost peppers? And they said, hell yeah, we can do whatever you want. I just throw a couple in there.
I don't like the ghost pepper flavor. You
don't? Okay,
No.
but the Tabasco flavor. Have you
I do
tasted
like
my
the Tabasco.
sauce that I made?
But
That's how I got into
I
fermentation. And because we had these Tabasco plants. And listen, if you've never grown them, they're the most gorgeous pepper plant you'll ever see. They're big and bushy, and then they have the peppers all stand up. They're about an inch long. They all stand up and point toward the sky, and then they're all different colors. They're green, they're yellow, they're orange, and they're red.
beautiful.
And it's gorgeous. And so I said, I want to make Tabasco sauce out of these. I'm not wasting these, because I just waste peppers and stuff. I give them away or whatever. What the hell am I going to do with this? So I read up on it. It was like, oh, God, you have to ferment them. And so I had to buy all this fermentation gear, which really wasn't a big deal, but it was just kind of a thing. And then you got to brine them in 3% brine. And then you put them through a food mill, big pain in the ass. And then you have to add 40% of the volume in apple cider vinegar.
Nerd. Nerd alert. Nerd alert.
You're not wrong.
Did you do all these dilutions and percentages?
Wow, that is very interesting. Please tell me more.
So anyway, but it makes the best hot sauce that you'll ever have. And if you want, you can taste some.
Yeah, I will. I'd like to.
I think we have a bottle or two left. Anyway, check out Dr. Scott's website at simplyherbals.net. That's simplyherbals.net. And look at our Patreon, patreon.com/weirdmedicine. Tacie and I do a show there. We're a little bit slack, but I think we can maybe do a live stream here pretty soon if you want to. And if you want to make me do it by myself, I'm okay doing that too. I'll do whatever you tell me to do. And then if you want me to say fluid to your mama, or secretions to your daddy, just cameo.com/weirdmedicine. I dropped the price to $5 because I don't give a shit about making any money at it. It's just fun to do, and I really enjoy doing it. And sometimes we do it here in the studio. I did one in my office and had my medical student in the background. And I said, I'm doing your cameo with Gimli the dwarf from Lord of the Rings, because he had this big, giant red beard. Anyway, so we just F around with it. If you want Myrtle to do it, just say that. I had a guy that said, my wife hates it when you do. Well, you were here.
Yeah, that
when
was
I did
a good
Myrtle.
one.
Yeah.
Some kind of necklace.
I hope you're having you good. Anyway, so that's cameo.com/weirdmedicine. So I'm working on 3 hours of sleep. I take some anti-aging supplements that I think, I'm reasonably young, 67. Well, I don't know about that, but I mean, I'd rather look good than feel good. But, but I've been taking these anti-aging things because I got a young wife. I want to be able to keep up with her and stuff, and not have her married to some old piece of, some old man, and that's just doddering around in his dotage. And so I read an article about taurine, where if you take 1,000 to 1,500 milligrams of taurine, which is an amino acid, it helps promote healthy cell division and stuff, and decreases apoptosis or programmed cell death, right? So I'm like, well, hell, I'm adding that to my armamentarium. So I got some taurine. It came in the other day. Well, I take all my medicine at night. I take everything at night. I hate taking medicine twice a day, so I take it at night. So last night I took taurine and then wondered why I woke up at 3 o'clock and could not go back to sleep.
Isn't that what they put in Red Bull?
Yes, of course.
Taurus Bull.
Yes.
Well, that's because you're an idiot.
Yep. That is one of the ingredients in energy drinks. And Richard David Smith and his lovely wife Shatai will tell you that, because they make Hyperphysics, an energy drink for nerds, and that's what it was. And the thing is, So then I have to come in and we're doing this, and I'm one part of my brain is operating on 12 cylinders, but the other part of my brain is really working on about 2.5.
Okay.
So it's pretty interesting. So anyway, we'll see what happens today. All right, very good. Oh, and PA Lydia, I need to give you your bell.
Give thyself a bell.
Also depressing.
No, Tacie just refuses to do it on principle, and I think it's funny that she does that. So anyway, I'm saying hello to the Fluid family. The Fluid family are people that watch us on YouTube, and I can see the cameras are all jacked up and wrong, but anyway, that's all right. So check out Dr. Scott's website, even if he isn't here at simplyherbals.net. That's simplyherbals.net. And if you want to help us get this channel to a place where we can do live streams with, the super chats and all that stuff. If you'll go to our YouTube playlist that just says live shows and click on the first one and say play all, and then turn the volume down and go to bed. It'll play the whole thing. We got to get up to 4,000 hours. And we've never made a big deal out of the video component of this show, but it's become clear to me that I got to quit being so effing old school and start learning how to do some things.
I guess I'll have to start wearing makeup and fixing my hair for these stupid things.
Well, you don't have to. Some people will do it where some of the people are off camera. Gino Bisconte does that on In Hot Water. There's this guy that's off camera that talks. So if you want to do that, we can. We can just have it where I'm the only one that's on. And we'll do StreamYard, and we put the link out where people can link in and say things to us. They can ask us questions, or they can say stupid stuff, or show me your tits, or whatever, and then I'd click off of them, of course. Because that's inappropriate. It's 2023.
And Tacie's not on camera.
It's 2023, Harvey. Oh, yeah. Oh, that would be me, wouldn't it? Shit.
Yeah.
Okay, well, that I don't have a problem with. Now, and I do have a new sort of game. PA Lydia, you're going to start coming back now?
I'm hopeful so, yeah.
Okay, so this is what I need you to do, because it'll be fun if you do this. So you need to check our iTunes reviews. And what I want everybody to do, if you're listening to this, go to our podcast on iTunes, give us a 5-star review, but shit all over Carl from WATP in the comments section. See, WATP has this thing, give us a 5-star review, but shit on us. And I just thought that'd be fun.
Yeah.
Yeah, Carl can handle it. So 5-star review and shit all over Carl from WATP, and then PA Lydia will read them.
That sounds great.
Okay, it'll be fun. And then we'll stop doing it, because I really I like Carl very much. He's a friend. We've talked about going on vacation together and stuff like that. So I'm just kind of fucking with him. So, all right?
All right.
Okay, very good. And do check out his podcast, Who Are These Podcasts? Loads of fun. There's a lot of crazy Inception-like things going on in that universe right now. And it is very confusing if you just turn the radio on. You don't know any of the players. But that's part of the fun, is figuring it all out. But the ringleader, if you really want to know, the person that started all of this, that is one, what is it? Six things to Kevin Bacon. 6 degrees. This person is 1 degree from everybody on there, and that, my friends, is Cardiff Electric. So that's all you need to know. All right? Okay. All right. Let's do, I think it's time already to do some Tacie's Topics.
It's Tacie's Time of Topics, a time for Tacie to discuss topics of the day. Not to be confused with Topic Time with Harrison Young, which is copyrighted by Harrison Young and Area 58 Public Access. And now, here's Tacie.
Well, hello, everyone.
Hello, Tacie.
So today we're going to take it down a notch and get depressed.
Okay. Yay.
So I figured
I need to
a lot
change
of
the category from comedy to something else.
Yeah, maybe for today. I think
Okay.
a lot of us have children, and so I thought this was an important subject. What is children's therapy, and does your family need it?
Okay.
In the 10 years leading up to the pandemic, there was a 40% increase in mental health issues in kids. 9.4% live with anxiety disorders. 8.9% have behavioral issues.
They scared the shit out of all of us.
Yeah, 4.4% have depression. What is, child therapy, and does your kid need it? Psychotherapy or talk therapy helps kids understand and manage their feelings, change behavior, communicate more effectively, and build resiliency. Yeah. Remember, you are the expert on your child. If you think something is off, you need to reach out. Therapy should not be viewed as a last resort. Right. It helps strengthen your child before the wheels come off.
I think everybody should have therapy. I really do.
Agreed.
We can't go into our brain and I don't understand why we can't, but go into our brain and say, turn that thing off. There's a circuit in there that says the wrong thing every fucking time. How come I can't go in and turn that off? Why do I have to learn the same lesson over and over again? But in therapy, you can explore those things and write new scripts. Not me yet, but, working on it. So anyway.
So if you notice changes in your child's daily mood and social interactions, that's when you need to be concerned. What are some of the benefits? Therapists are teachers or coaches who help kids understand their thoughts, feelings, and behavior, teaches them to be mindful of their feelings, and gives skills to manage emotional behaviors. Child therapy is thought of as a collaboration between the child, parent, and the therapist.
Yeah.
So types. There are several. Cognitive behavioral therapy. If we become more aware of our thoughts and feelings, we can learn to control how we react to them.
Give thyself a bell.
Can be helpful for trauma survivors. So if your child's been in some sort of trauma, maybe a cognitive behavioral therapy.
And you think cognitive behavioral that they're going to change out, they're changing internal behaviors, the scripts and it's usually, it can very often only last 6 weeks. So it's very effective.
Okay.
Go ahead. Yep.
Dialectical behavior therapy, most often used with suicidal teens. The mainstay in treating borderline personality disorder and often involves a combo of individual therapy and kids and parent coaching.
What does dialectical mean?
I don't know.
I'm going to look it up.
Play therapy, which we did this with one of our kids, and I thought, this is silly. This isn't going to work, and it did wonders. It creates an enjoyable environment for kids. They observe your kid to see what themes they are expressing through play, and it's helpful for younger kids.
Yeah. Yeah, our kid did very well in that.
Yeah.
He was just having some anxiety and stuff. One of the things I really liked was when one of the doctors who saw him, and the first visit, our kid was complaining of anxiety. And what the guy said was, and I will never forget this, and I really appreciate it. He said, if you've got a lion stalking a herd of gazelles, and you got one gazelle that's nervous and looking around all the time, where's the, is there a lion? Did the grass move? Or you got one that's going, everything's okay. I don't have anything to worry about. Which one is probably going to get eaten?
The everything's okay.
Yeah, the one that's not. He said, so having anxiety can be a good thing. And my kid, it was just like his eyes opened up and went, oh. And one of the he was not performing in baseball the way that he wanted to because he'd get anxious when he was at bat. And he said, you're holding a stick and somebody's throwing a rock at you. Basically, that's what it is. Why wouldn't you be anxious about that? So he just normalized it, and it really helped. That was in the first 15 minutes. I was very impressed. But anyway.
So parent-child interaction therapy. Therapist observes interaction through a video or one-way mirror, usually 12 to 20 sessions to complete, and offers parent coaching.
Yeah, we used to do those in my clinic, and you would see the kid, they would say the psychologist said, just let kids play. Just play with them. Let them drive it. And you'd have parents in there that would do that for like a minute, and then they'd be going, no, that's blue, or, count. Now, what comes after 2, and all that stuff. They're not playing with them. They're just fussing at them. So, people can fall into that and not even realize it.
Yeah.
By the way, dialectical means relating to the logical discussion of ideas and opinions. So
The last type of therapy is just family therapy, where the family gets together, communication and learning to understand one another. It's helpful with anxious kids or ones whose parents are having marital conflict.
Yeah.
Oh, there's also behavior therapy. ADHD modify environments so that the kid can control their behavior. Allows for more positive discipline and behavior. Talk to your pediatrician for recommendation.
Right.
This came
and
from
that's
Parents Magazine.
Very good. Well, you get a bell for that.
That was great.
Give thyself a bell.
And behavior therapy is distinct from cognitive behavioral therapy. So they're two very different things.
So the second topic is how to handle a child's mental health emergency.
Okay.
For example, a suicide attempt. How do you know your child is in crisis? And, you know, for somebody who's got teenagers, I remember one day our kid just started crying for no reason, and we had no idea anything was going on. They don't really tell you, you know. So you just have to watch for mood changes, behavioral changes, or your gut just shouts it out. Some are masters at hiding it, refusing to get out of bed, runs away, or having suicidal thoughts, significant weight gain or loss.
They say anything about cutting in there?
No, nothing was said about cutting in there. But what if an attempt is made? Be calm and non-judgmental. It's not about you. Reach out to your child's therapist or pediatrician. Dial 988, the Suicide and Crisis Lifeline.
Is that true over the whole country?
According to this, it is.
Yeah, okay.
Also, 911 if an attempt has been made. There are intensive outpatient programs where you can go 3 times weekly for group therapy for him or her, and 2 times weekly for parents. Listening to other kids makes them feel less alone. Best prevention, talk openly with kids about mental health from the start. The perception that talking about suicidality increases it is inaccurate. Okay, so I didn't read that correctly, but if you talk about it, it does not increase the likelihood that it will happen. It destigmatizes it.
Right, that's right. You're normalizing it. And that's true of end-of-life conversations, too. People feel that increases anxiety. Actually does just the opposite because you've let the elephant out of the room, and now everybody can speak freely.
Yeah, it destigmatizes it, so don't overlook your own self-care either. Online resources, SAMHSA, which is SAMHSA for parents and caregivers, warning signs and how to help. There's also National Alliance on Mental Illness Family Members and Caregivers Resource Guide.
You know what else you can do with that 988? You can just text them. I'm looking it up right now.
Cool,
you can
right?
just text 988, and if you are feeling, or someone that you know is feeling suicidal, they can help.
So there's several things you can Google if you are more interested in this topic or you think you need help in this area. Like I said, the National Alliance on Mental Illness Family Members and Caregivers Resource Guide, Mental Health Resources for Parents and Adolescents and Young Adults Guide. They have links and treatment locator services. And your kid's school may also be very helpful.
Yeah, the FCC designated 988 as a nationwide mental health crisis and suicide prevention number, and they've done that since 2020. The National Alliance on Mental Illness was lobbying for that, and it's a nationwide 3-digit number for mental health crisis. It's been in the works since 2020. I didn't know anything about it. I should know this. I know about SAMHSA. And we utilize SAMHSA, but I didn't know anything about this. So I'm going to give you the long bell for that.
To thine inner voice and give thyself
it's a shame
bell.
Scott's not
no
here.
task shalt be denied if thy will be
I'll
strong
text
and
him.
true. For when a bell is rung, it carries with it the sound of courage, that giveth strength to even the meekest of hearts. So ring thine own bell, and be mindful of its power and might, for 'twill be thy guide in whatever task thou setst thy sight.
Well, I especially appreciated that your report didn't include anything about medications, which are also fine, but there are so many other things that can help.
I think oftentimes both used together.
Sure.
You know, and I think just reaching out for help is the first step, of course, because so many people think it makes you weak, and it does not.
Correct.
No.
Correct. Yeah, so many people suffer in silence, and that's adults as well. maybe even more. The kids don't know that there's something available. The adults usually do, and they don't seek it because they feel the stigma. So there is none. You will not be judged. That's the one place you can go and say anything you want, and you won't be judged. Unless you threaten to kill somebody, and then they have to do something.
I have a small story about self-awareness.
Okay.
So on rotations in PA school, I was at a Veterans Administration deal in the Midwest where people could live on campus. There was a large psych ward where people were housed if they had a suicide attempt or were brought there for being suicidal. Homeless people could live there. Homeless veterans could live there. And I would attend sometimes morning cognitive group CBT, morning cognitive behavioral therapy for the group.
Got it.
And so I would go and I would just sit back and listen, initially thinking, well, I'm just going to learn what they do. Nothing applies to me here. And then they talked about awfulizing. Have you heard about awfulizing?
No.
No, is it like catastrophizing?
It is, yeah. It's something that I did in my head that I never even realized I did, where you make up these, basically like all these different scenarios that are not reality in your brain, and you spend time
worrying about
things that aren't actually happening, right? What could happen. So that was a very important therapy session for me.
I think the 12-step trope that if you've got one foot in the future and one foot in the past, you're in a perfect position to shit all over the present. And we live in the present, and we just constantly shit on it by worrying about stuff that hasn't happened that obviously we can't do anything about. We can try to prevent it. But stuff in the past that there's absolutely nothing we can do about.
Yeah.
Live in the moment. Mindfulness is a big deal. And matter of fact, we're starting a clinical trial in our cancer center for chemotherapy suite-induced anxiety. And we're going to be using virtual reality environment called TRIP, T-R-I-P-P. I've mentioned on the show before. And half the people will do the full TRIP protocol for 10 minutes and then judge their anxiety. And half of them will be in a virtual environment where it's just like a river. And then we'll see if there's any difference. Because
that's great.
Yeah, you can't just do it against no control. You got to have some sort of control. But anyway, yeah, I think it's going to be interesting, and it is. That's all about mindfulness, just being in the moment.
Is that going to be at all centers? Can I refer patients to your clinical trial?
Well, yeah. Well, yeah. You know what? Yeah, we'll work it out. I'll come up there and do it.
Well, okay.
Yeah, okay. We'll talk. Anyway, yeah, because we'll be recruiting people. I'd like to have as many as we can because if we get null,
Does this mean I can't just give people Ativan? Just kidding.
I think you should.
You can.
It is part
This could be a part of a complete, comprehensive treatment plan. All right. You got anything else, Taste?
Nope, that's it.
All right. Anybody want to do that list of penis news?
I'll let you do that.
You want me to do it? Okay,
yeah, it's quite funny.
Yep. So Carissa, DNP Carissa was here and did some penis facts, but she left her notes behind. There's all kinds of stuff she didn't do on here that I thought was pretty interesting. So the ancient Romans thought that penile hardness was directly linked to what a person ate, and that the shape, color, and flavor of certain foods impacted one's sex life. Consequently, root vegetables such as carrots, well, no kidding, became, talk about being on the nose, instant symbols of strength of libidos. And then, during the Inquisition, this was the Inquisition where the Catholic Church had a division that was trying to root out heresy, right? Yeah. And women were executed for knowledge of Satan's penis. For example, in 1600, Anna Pappenheimer had her breast torn off. Oh, God, this is too great. This is a horrible show. Let me find one that's a little more fun.
Oh,
but they did bad. They did very naughty things to her. The ancient Egyptian god Atum declared, "I created on my own every being. My fist became my spouse. I copulated with my hand. His penis created all life, divine and mortal, through this act of sacred masturbation."
My hand became my spouse. I think that's where I'm at.
In ancient Egypt, the penis was so potent that it defeated death. Osiris, in fact, flaunted his virility in the underworld as king, declaring in the Book of the Dead, I am Osiris, stiff of penis. I am mightier than the Lord Terror. I copulate and I have power over myriads. I am Osiris, stiff of penis. I am Testicles from the island of Pinos. Anyway, all right. Let me see. The rest of this is probably going to culturally upset some people. So anyway, here we go. Among ancient tribes, it was not unusual for a new king to eat the penis of his predecessor to absorb his sacred authority. This practice was banned, however, by ancient governments that thought that was stupid. All right.
Good for them.
Yep. All right. One French stand-up comedian and illustrator once said, my penis doesn't look like... No, I don't know. Oh, my penis doesn't like the same women I do. Okay, I don't. Good for him. All right.
That's what he told his wife.
I guess there's a reason why Carissa didn't read those. So I apologize.
Maybe she deserves a bell.
Yeah. I'll give myself that. And maybe this.
Well, that's because you're an idiot.
And all right.
Give thyself a bell.
And that's for Carissa, who's not here today. All right. You guys want to answer some questions?
Sure. Number one thing, don't take advice from some asshole on the radio.
Today's episode is brought to you by Angie. Angie has made it easier than ever to connect with skilled professionals to get all your jobs and projects done well. Let me tell you, there's the version of it where you try to do something at home, and then there's a version of it where you have someone help you, you watch them do it the right way, and you go, thank God I didn't try to do that myself. I have fully done things around the home that I think look good, and then a bang in the night, and I wake up to a shelf collapsing, a painting falling off the wall. I've seen it all go south. I own a home, and I can tell you, I know how much work it can take. Whether it's everyday maintenance and repairs or making dream projects a reality, it can be hard just to know where to start. But now all you need to do is Angie that and find a skilled local pro who will deliver the quality and expertise you need. Whatever your home project, big or small, indoor or outdoor, you can Angie that and connect with skilled professionals to get the project done well. Right now, one of my wish lists is I want a bike for my condo in Milwaukee, and I would love to rig it up on a pulley in the ceiling because I have one of those lofted ceilings, but I'm so scared to try that on my own. Angie has 20 years of home experience, and they've combined it with new tools to simplify the whole process. Bring them your project online or with the Angie app. Answer a few questions and Angie can handle the rest from start to finish, or help you compare quotes from multiple pros and connect instantly, which means you can take care of any home project in just a few taps. Because when it comes to getting the most out of your home, you can do this when you Angie that. Download the free Angie mobile app today or visit Angie.com. That's ANGI.com.
This is what you do when you've just found that statement handbag on eBay and you want to build an entire wardrobe around it. You start selling to keep buying. Yep, on eBay. Over that all-black everything phase? List it and buy all the color. Feeling more vintage than ever? It's out with the new and in with the pre-loved. Next thing you know, you've refreshed your wardrobe basically without spending a dime. Yeah, eBay, the place to buy and sell new, pre-loved, vintage, and rare fashion.
Hi, I'm Lara, and this is the Lara Bar story. I was on a hike in the Rocky Mountains when I felt inspired to make something that tastes indulgent and delicious using just fruit and nuts. 20 years later, Lara Bar is still at it. From chocolate chip cookie dough to cherry pie, there's a Lara Bar made for you. 100% real, 100% delicious. That's Lara Bar. Find your flavor at larabar.com.
ABC Wednesday. It's the premiere everyone is talking about.
I'm Joan, and I'm your first Golden Bachelorette.
Loves getting a second chance.
When you're 61 years old, you have very few opportunities to change your life. I have to be ready.
The Golden Bachelorette is proving romance never ages.
I represent millions of people in their golden years looking for love.
The Golden Bachelorette.
I am ready to find the next great love of my life.
Series premiere Wednesday on ABC and stream on Hulu.
Discover My Self Le Parfum by YSL Beauty. The new, sensual, and warm intensity enhanced by spicy vanilla bourbon. A fragrance for a man born unapologetically himself. Myself, Yves Saint Laurent.
Help if I was potting up the correct pot on that, but okay, here we go.
Namaskar.
Namaskar.
Steve and crew. No, I didn't go to Thailand. Actually, I'm in Nepal.
Yeah.
I've been in Nepal for
I speak Hindi,
a few months
Hindi
now.
in Nepal.
And when I got here, let me tell you.
Up Casey have pagal dost. That means, how are you, crazy friend? And he's going to tell us.
I had explosive diarrhea for about a week. Went to the ER over here. They gave me some
Borahe. That means
antibiotics and some probiotics, so they're battling it out in my stomach right now.
Yeah.
But no, after that, everything was fine. I'm still in Nepal. I'm in Pathan, actually, which is in Nepal.
Yeah, you established that.
So, yeah, it's been lovely. The weather's great, and the people are awesome.
Yeah.
Everybody's super kind. The food, the hygiene, let's say, is a little iffy. So I'm kind of picking and choosing where I...
Well, by our standards. You know, you'll notice that folks that live there eat that stuff just fine.
eat now. There is no fast food here. I mean, there's fast food, but it's pani puri, which is diarrhea in a ball, essentially. Look up some pani puri. You wouldn't eat it either.
Okay.
But it's actually really good. So, yeah, I've been enjoying my time in Nepal.
Good.
And, yeah, I came here for a lady. I'm not having wild sex, just regular sex, but a lot of it with one person. So,
Yeah.
good times.
All right, man. Well,
good for you,
well,
man.
it sounds like he's having fun, and she must be, a good egg if she's tolerating him with his explosive diarrhea.
It's a shame he's not on 90 Day.
Yeah. Oh, yeah.
Ah.
He should be on 90 Day and just in the bathroom the whole time. That is, okay, it's a guilty pleasure for me. I like to sit down and watch 90 Day Fiancé with Tacie. It's one of my favorite things to do because I just yell at the screen the whole time. What did you think was going to happen? You're in another country. Stop, trying to make them be like you. It's not happening. If you can't change... No, I don't even want to talk about it. I get really mad. There is a woman that wants to change 1,600 years of history, of tradition, about how women dress in that country overnight.
Oh.
And she left this guy because she couldn't handle the rules. And then she came back. It was like, nothing's changed. Why are you back here? And she was just as mad from day one, wasn't she?
Mm-hmm.
So it's just crazy. And that's what they pick. You generally don't pick functional.
I was going to say,
it's for entertainment.
They edit for that.
Yeah, and they will edit it to make people look worse than they are, too. I've been a victim of that myself when I was on the Jane Whitney show back in the day when I was writing books about internet love, which I unfortunately knew too much about. But anyway, so let's talk about his traveler's diarrhea. It's the most common travel-related illness, and it can occur anywhere. Highest risk destinations are in Asia, except for Japan and South Korea. But Middle East, Africa, Mexico, Central and South America, so basically kind of everywhere. The thing is that I get traveler's diarrhea every time. I mean, we've been to Hawaii, twice, Tace? Two or three times.
Yeah.
And I get it 100% of the time there. And their food's, it's America. They have different bacterial flora on their food that my stomach isn't used to. So I should probably take a probiotic when I'm there, and maybe that would prevent it. I don't know when we'll ever get back there again. We did it for work, but and now Tacey's retired, so that won't be happening. But one of the things that you can do is choose your food and drinks carefully. I remember when we were in the Dominican Republic, they had ultra-filtered water in the resort. But when we went out on the booze cruise, what I wanted to do was, liquor, And bottled mixer, no hielo, no ice. Okay,
sneaky.
Yeah, because the ice can sometimes not be filtered water on those trips. So that's something. And obviously, wash your hands. But if the people making your food aren't washing their hands, just make sure it's cooked thoroughly. And there's a couple of over-the-counter drugs that you can take. Loperamide is one that can slow down the diarrhea. If you have a bacterial infection, which this usually really isn't, Shigella or Salmonella, that's a different beast altogether.
What's the brand name of that, Steve?
Imodium.
Imodium.
Okay.
Yeah. Now, but I don't recommend that. What I recommend, if it's not contraindicated, is bismuth subsalicylate. And if you'll take, and that's Pepto-Bismol tablets, you take 2 tablets before each meal, most of the time that will prevent traveler's diarrhea. And if you have this problem, email me, drsteve202@gmail.com, and I will send you a thing about using bismuth subsalicylate for the prevention of traveler's diarrhea. The way it works is the bismuth has such a high surface area, little crags and crannies and stuff on the molecular level, that bacterial toxins will adhere to it preferentially instead of to the bowel wall.
Huh.
That's the supposedly working hypothesis. So.
Well, that's a part of treatment for eradication of H. pylori, right?
Well,
I don't remember.
Because of
I remember it was Biaxin, amoxicillin, and lansoprazole, right, Tace?
And some other things, too.
Oh, okay. Maybe it was bismuth then.
I'll check it out.
Yeah, check that out.
What's in PrevPack?
Yeah, the PrevPack was clarithromycin, amoxicillin, and lansoprazole or Pepsid.
So there's for H. pylori and duodenal or duodenal ulcer in children or adults, this is not actual recommendation to do this, right?
Okay.
But a regimen is bismuth subsalicylate with flagyl or metronidazole.
Yeah, flagyl's
and
a big one.
Tetracycline.
Okay.
So
for H. pylori? Okay, well, they've changed. The old PrevPack was that, this stuff's always evolving, and I don't really treat that anymore.
Yeah.
But I would not give bismuth subsalicylate to a little kid because it's like giving them aspirin. And there is a risk if they have a fever of Rye syndrome, so we just try not to give it to little kids. There are some syndromes where they will give kids aspirin, despite the Rye syndrome risk, because the risk is low in those particular indications that they give it for. But anyway, in general, don't give little kids aspirin unless your primary care or your specialist tells you to.
You can also check, if you know where you should know where you're going for traveling. So the CDC has a traveler's website for each country.
Correct.
And they will give you tips and tricks.
Particularly if you have to get certain vaccines to go there.
Right.
Or if they would be beneficial. I think everybody should have hepatitis A vaccine in a minimum, because hepatitis A sucks. It's just basically a puke bug that then after you're done puking, you get jaundice because your liver isn't working right. And then I think everybody should have hepatitis B and C vaccine. I mean, why deal with that anymore? Hepatitis B vaccine is actually an anti-cancer vaccine. I had a physician correct me when I said the only anti-cancer vaccine that we truly have right now is Gardasil.
And he said hepatitis B?
Yeah, but he said, if you don't get hepatitis B, having chronic hepatitis B, which is a small minority of people, a small minority of those will get hepatocellular cancer. So, hey, are you seeing a decrease at all yet of cervical cancers in young women since Gardasil has been on the market for over a decade now?
I haven't checked the SEER data to see if there's a decline. I can check it really quickly.
I know there is a decline in abnormal pap smears. They have identified that. And it takes time. I mean, if you have an abnormal pap smear, it can take 10 years to develop cervical cancer, which is why I recommend people get their effing pap smears. Because if you catch it on year 10, it can be a real problem. But if you catch it on year 3, you just take care of it right there. your gynecologist can be your best friend on preventing cervical cancer.
So on the SEER database, which is our CDC government report, cancer.gov database of cancer, there is a sharper decline between 2018 and 2020 of new diagnosis of cervical cancer cases.
Really? Now, some of that's COVID, though.
And we also know that the screening guidelines for cervical cancer were relaxed a bit, right?
Right.
Where instead of annual screening, we're Q3-year screening.
And I'm so old school,
Listen, I had an abnormal PAP, in 2009. My mom was an anti-cervical, anti-Gardasil person.
Okay.
And so I had an abnormal PAP with dysplasia, needed a surgery because of an HPV.
Right.
Deal. So I did that and then got the vaccine.
Yeah, sure. Yeah.
So I'm that way too. I'm annual, please.
Yeah, right. Well, you should, because you had an abnormal one. There is a different protocol for people who had an abnormal pap smear, but then if it converts back to normal, then you can go on the other thing. Again, check with your OBGYN on that, because they're the experts on these new protocols. And if you're interested in looking where these protocols come from, there is a website, USPSTF.com, I think, or is it .gov? Let me see.
Preventative Task Force.
USPSTF. It's got to be .gov, right? Nope. Well, maybe it is. Nope. I think it's .com.
So we're U.S. Preventative let's see. U.S. Preventative Services Task Force.org.
.org, for goodness sake. Why didn't they just spend the money to get .org?
That's the deal, right? It was the Google domain available for the good price.
Yeah, somebody took it, I guess. Okay. Yeah, but you can go there and you can see what is available for you and all that kind of stuff. So, all right. And what screening things they recommend. They recommend that providers ask about smoking. I mean, some of this is not invasive. Checking your blood pressure. We don't really do rectal exams much anymore, because that's fallen out of favor in favor of just checking PSAs. So, don't fear going to to get your physical every year. Did you find something?
Well, the very first thing on there is abdominal aortic aneurysm, which I wonder I expect is very underscreened. So men aged 65 to 75 years who have ever smoked. USPSTF recommends one-time screening for abdominal aortic aneurysm with ultrasound in men aged 65 to 75 who have ever smoked.
Really?
Yeah. So your abdominal aorta is the large blood vessel that pumps blood from your heart down to your lower extremities, and aneurysms sometimes are dilate, and it can dilate to an area where the vessel wall gets so thin that it could rupture.
Yeah.
And that causes an almost immediate, very painful death.
That is correct.
Yeah.
Give thyself a bell.
You know what else causes an immediate death? I was on a show once, and they asked me what's the worst death that I ever saw, and it was an aortoesophageal fistula, which what that means is the aorta has a connection with the esophagus, and cancer would eat a hole through the esophagus into the aorta. And when that thing is finally breached, the patient will stand up, open their mouth, 4 pumps across the room. That's how much pressure it is, and then that's it.
Blood.
Yeah, 4 pumps of blood. So, get your screening stuff done. The 2018 to 2020, that actually predates COVID. So, a lot of people didn't go get their screenings during COVID. So we're going to see a bit of an uptick in cancer for a while, I'm afraid, because of at least 2 years of people not getting the preventative services that they once did. And, we all have a little bit of PTSD from that, I think. I certainly do.
Yeah.
And, anyway, I don't want, I don't need to talk about it. But anyway, it's, just Google USPSTF, because it's actually not that. It's US Preventative Services Task Force.org/USPSTF. Why didn't they just buy the domain? It's for sale. The .org, the .com, and the .gov are all for sale.
Everything has a price.
Well,
right?
Yes.
We should look it up and see how much it costs.
Oh, well, that's a good point. You know, the ones that own these domains, I had to pay $1,000 for drsteve.com. And I've got two of them. I have the drsteve.com and I've got the spelled out drsteve.com. Nice. That's not nice. And it was a lot of money. And it was when we were first starting out. But since there are some other famous Dr. Steves out there, hell, they can, I'll sell them to them.
Exactly.
And then we'll just have weirdmedicine.com, you know?
Yep.
So, if anybody knows a Dr. Steve out there that wants a domain, it's for sale. Your old pal needs money.
It would be a plastic surgeon.
Yeah, there you go.
100%.
Yeah. All right.
Hey, Dr. Steve.
Hello.
It's Mike in New York.
Hey, Mike.
I want to thank you for your continued service.
Oh, thank you, sir.
I appreciate it. This could be for the Patreon.
Okay.
I know you think you're
That's okay.
done with COVID, but I don't think, especially now with Kennedy in the election, that you will be done with COVID for a while. I was curious if you've listened to Joe Rogan's RFK Jr. Interview.
Yes.
And his interview with Dr. Asim Malhotra, a British cardiologist, both of whom have a lot of questions about the COVID vaccine.
Sure.
And they both cite studies. I don't know how good these studies are or how well-versed or the type of studies. I was just curious if you've listened to them.
Yes, I have. And here's the thing. I said from the beginning, we needed therapeutics. This concentration on a vaccine for a coronavirus that's been demonstrated in the past to not be effective because we can get coronaviruses over and over and over again. And, but they were so focused on a vaccine that drugs like favipiravir, which I talked about, you can go back and look at my COVID sit reps from like June of 2020. This is only 3 months after it started, where I was talking about this Japanese drug called favipiravir that was effective against RNA viruses and was already on the market. Phase 1, phase 2, phase 3 already been tried. Hell, give it emergency use. They're in phase 4 and it's a safe drug. Let us do it. Nope. We got molnupiravir 18 months later because somebody went, well, okay, that kind of stuff. If we had, and people are sick of hearing me say this, but PA Lydia, you and I haven't talked about it. Tacie, I'm not sure you and I have. If we'd had a drug like that was effective, like Paxlovid is now, if you were at high risk, you take the prescription to the pharmacy and you get the pill and you don't go to the hospital, you don't end up on the vent, and you don't die. That's what we needed because we can't vaccine our way out of this.
No.
And we didn't vaccine our way out of it. Even at the end of it, all the people that I saw, I remember I went to a hospital, I had a 6-bed ICU. Every single person that was on the ventilator was not vaccinated. So it obviously did help, but we got out of it by Omicron just infecting everybody.
Yeah.
And that was, and when this thing first started, it had an R0, a effective transmission number of like 2.4. And back then I was saying most people won't get it and most people who do get it won't die. I think the vaccine is an important part of prevention of severe disease in the elderly and other people at risk. And I think that mandating it for anyone else, I think the FDA, when they finally lift the emergency use and they come up with an indication for it, it's not going to be for the not vulnerable population. So when you have, let's say, 10 to 18-year-olds and healthy 10 to 18-year-olds, and they get coronavirus, they're going to have cases of myocarditis. It happens. The virus causes it, but the vaccine can cause it as well. It's the body's and it generally happens in males, to young men, and it's the body's reaction to that antigen that causes the body sometimes to attack the heart muscle. The good news is that in almost all of the cases, those kids get better, but in some they don't. So and I've looked at numbers, and I can give you a study that shows that the vaccine creates less myocarditis. But then they don't ever look at, well, if the kids get COVID, what happens? They never go that far. They just say the vaccine, we followed them, they didn't get myocarditis. So I can show you that data. We can all cherry pick studies. What we need to do is mash all the data together into a meta-analysis and look at the whole thing and see if there's a statistically significant benefit for anybody, and there will be, but it'll be for the vulnerable population. I think, we should absolutely vaccinate vulnerable populations, and it remains to be seen what we're going to do about mandating it for anybody else.
Yeah, I think a very stark memory for me of the start of the COVID.
This episode is really a bummer.
Was for our cancer patients when they were tested positive, or even before they tested positive, before we had tests, or before it was an act of Congress to even get a test.
Right.
Person comes in with unknown virus or illness. When they would get in that wheelchair or in the bed to be admitted to the hospital from the cancer center, it was goodbye.
Yeah.
And that's not the case anymore since the vaccine.
Right. Since molnupiravir and Paxlovid. The other thing that I've seen, and there are other therapies too, outpatient remdesivir is as good as Paxlovid. It's just a pain in the butt to give. So they have an oral version of it coming if it's not already on the market. I had some stage 4 cancer patients that got COVID, got put in the hospital, and just sailed right through. Yeah. So it just goes to show you, there's a natural variation in humans. And coronaviruses are not new. There's 5 circulating endemic coronaviruses. Now we have a 6th, and they cause the common cold most of the time. But every year we'll have, in this country, 10 to 20,000 people who die of quote-unquote atypical pneumonia or viral pneumonia, and they had COVID-like syndromes. We weren't testing for that stuff now, or then. We'd just say, well, you got a virus. Now, the one benefit of this is kind of cool, is when you come in with a viral illness, they can do this viral panel. It'll say adenovirus, rhinovirus, picornavirus, all this stuff. It's pretty damn neat.
Pretty cool.
Yeah. Anyway. I will take the RSV vaccine. RSV almost killed one of our kids, but thank God Tacie was breastfeeding because she had the antibodies against the RSV, and he just sailed right through.
Good.
Yep. It was amazing. They were pretty convinced that if he lived, he would have, terrible lung problems because he was so young. But no, they surprised him because she continued to breastfeed him. And saved his life. That was more effective than anything else they had because they really didn't have anything. Yeah. Just supportive care. So thank you, Tacie.
Yeah, even though I gave it to him.
Well, okay, yeah, but you saved it from it too. So that's the more important
having
thing.
It allowed you to produce the antibodies that you transferred to him through your breast milk.
So I tend to look at the positive. Yeah, you gave it to him, but you saved his life, so thank you.
He would have gotten it,
Yeah,
okay, let's do let's Tacie's
hey,
feeling.
Dr. Steve.
Let's do this.
This is Matt, the nurse from Connecticut.
Hey, Matt.
I hope everything's going well.
Yes.
Just 2 quick points that I want to see if I could reach out to you for. The first off is I just wanted to give a shout out to Tacie. I think it's awesome, the progression of her on the show. She went from someone that would just get hung up on, or actually hang up on you when you would answer the phone.
That is true.
Topic time and everything. She's such a great
Oh, that's wonderful.
Show. And I just want to make sure that
Thank
she
you.
knows that she is very well thought of and such a contributing member.
And the thing is, if I tell you that, it
doesn't mean anything.
Right, it means nothing to hear it from somebody else.
That was very sweet.
Yeah, it was.
And that being said, I have a question about my nuts.
About what?
So, when you get hit in the junk, why does it not hurt in your nuts?
Yeah.
Why does it hurt up in your abdomen, in your flanks?
That's easy.
when
That's
you
a
get
good
the
question.
balls, why does it hurt everywhere else but your balls?
I don't give listeners bells often enough, but that's
Give thyself a bell.
I'm giving him a bell for a great question. So if you get kicked in the nuts, it hurts where you would have ovaries if you had ovaries. So why is that? It'd be Lydia, you know the answer.
The only thing that comes to mind is the pudendal nerve, but I do not know.
Well,
what.
okay, when the nuts are developed, they develop in the abdomen, right
Yeah.
around the place where the ovaries would be, and then they descend.
So
And
they leave behind their nervous system?
Yes, that drags the nervous system with it.
Okay.
Just like the liver and the back of the shoulder, when you develop, are in the same area and they use the same nerve plates, and when they separate, they drag those with you. So liver pain can sometimes present as posterior shoulder pain. Likewise, the heart and the left arm, or the heart and the neck, they share some nervous. So when the heart is damaged, you get pain in your left arm. My dad had it just pain in his shoulder. So that's called referred pain, and that's why. It's because those places were in proximity back in the day when you were developing as a fetus. It's pretty cool.
That's cool.
Now, some kids will have non-descended testicles. That's a whole nother thing. If your kid doesn't have 2 nuts in the sack, you can leave them alone for a while. They'll recommend it. But if they hit puberty and it's still that way, it's either got to be brought down or it's got to be removed, because a certain percentage of those will become malignant. You ever seen one of those?
I have not. I haven't
is rare.
explored every case, so every testicular cancer case for prior undescended testes.
Okay.
But, that's a very important.
Yeah, well, they would still have an undescended testicle. So do you guys not check their nut sack when they come in?
No, well, we do. I just wonder if, because even late dissension raises your risk of testicular cancer.
Oh, is that right? Now that
Yeah.
I didn't know.
Yeah,
Okay,
so.
well, you get a bell for that then.
Give thyself a bell.
Anytime you tell me something I don't know, which is frequent these days.
So I haven't ever explored people's histories. And testicular cancer, though very important, is relatively rare.
Yes.
Right. So I don't see a ton of cases.
Every October we go over the self-testicular exam on the show. We did that on our very first show in New York when we did it from the Opie and Anthony studios. And every year I'll get 1 or 2 people that email me and say, I found something, and yeah, that's what it was. So, and they took care of it, and they wouldn't have done it if we hadn't just kind of walked them through it. So we'll do that again this October. But yeah, that's why I say at the end of every show, check your stupid nuts for lumps. It is a young man's disease. Every woman knows about self-breast exam. Most guys have never heard about self-testicular exams. It is a young man's disease. Or if they did hear about it, it was in health class where they separate the boys from the girls, and then the boys are just laughing and guffawing, and they
I'm
missed
surprised
it.
that the pediatricians don't mandate,
I'm sure that they do. I mean,
but they just don't. I'm sure it's such an awkward thing too. That
but
kids gonna
I
walk
talk
out.
to adults and I said, have you ever heard of that? And they'll say, no, nobody ever told me that. So they may have told them, sometimes
Not absorbed.
Right. But it was not absorbed unlike a downy paper towel, right? Before we go, we had a question from the Fluid family. Love it, a.k.a. Patty Blue, wanted to know, should people get the shingles vaccine? And that, to me, is an unqualified hell yes.
Yeah.
Shingles fucking sucks.
Sucks.
I've seen people get shingles on their face.
On their crotch.
Right. And those are the 2 really bad ones.
That's where I had it.
If you get it on your crotch, you
Damn.
think you have herpes, and you think your partner's been doing something, or your partner goes, well, no, I hadn't been doing anything. It must be you.
Did that happen to you guys?
Well, I made them check to see
if it was
for sure.
Yeah.
Yeah,
Well,
because
that's
she's suspecting me, and I'm going, well,
You got to be objective.
what have you
here.
been doing? Because, So anyway, but yeah, it was that was never serious, or seriously. I mean, it wasn't a problem, but we were kind of joking about it, and then she got tested, and it was actually varicella zoster, not herpes simplex. So having it on your crotch sucks. Around well, let's talk a little bit about what shingles is. You want to talk about what it is? People get sick of
it's a reactivation of the varicella zoster or chicken pox.
Right.
So anyone who previously had chicken pox, that virus lives within you, remains dormant, and it can manifest as shingles by expression on any dermatome. So any
nerve root
throughout your
it's
body.
Weird that it's just one and it's on one side.
Yeah.
So when the chickenpox vaccine retreats when you're a kid, it nestles in a single nerve root. It may be in others, but then maybe the fact that it gets expressed prevents others from doing it. But it's weird.
Yeah.
So on the rash, you see a sort of a chickenpox, blistery, papular, ulcerating rash along one side of the body or the other.
Yeah, and we can tell as providers when it looks suspicious for shingles because it does travel along one dermatome.
That's right, and we know the dermatome.
Area of skin that we know is innervated by one specific
all the
nerve.
peripheral nerves.
Yeah.
And it's peripheral nerves. It seems like, why didn't it do it inside? Thank God it doesn't. It would kill us. But, if you get it in your face and into your eye. Now, you had a scare about that, right?
I did. It's a bit embarrassing now. I was
Good.
super stressed a few months ago. I just finished my doctorate. Have the organization.
Oh, yeah. Congratulations, by the way.
Thank you.
Yes.
What was your dissertation on?
So I actually did cell-free DNA from cancer and screening. So early stage cancer screening through blood tests.
Yeah.
Okay.
Give thyself a bell.
So we'll see how that
that's awesome.
comes along at the U.S. Preventative Task Force. Is expected 2024 to be part of our usual training. Yeah.
And you did that?
Well, no, I didn't do that. What I did was make a nice algorithm for family providers to compare colonoscopy, cell-free DNA, low-dose lung CT, cell-free DNA, the stool kits, things like that.
Cool.
Anyway, so I was at work one day, and I felt on my the side of my temple this blister, and I had convinced myself that I had shingles because of all of the stress I was under. And shingles in that area would be likely to go to your eye. It can disrupt your cornea. It could eventually cause blindness.
Correct.
And so I immediately had someone prescribe me Valtrex because I knew I had shingles. I had pain. And then about 2 hours after I took my first dose of Valtrex, I remembered burning myself with a curling iron.
You get nothing.
Well, that's the wrong one.
So I do have a good supply of Valtrex now.
You are one pathetic loser.
Well, thank God that's what it was.
Yeah, it might have been a day after. I spent a solid day thinking I was going to go blind, possibly. Yeah. That's what stress
Well,
will do
and
to
the
you.
other thing about shingles is when it's gone, it can leave behind nerves that are so jangled that they continue to send pain signals to the brain. It's called post-herpetic neuralgia, and we have to treat that. So if you get shingles, get the treatment, because the hypothesis is that treating it early with valacyclovir, the antiviral, will help decrease the risk of having post-herpetic neuralgia. So, all right. But the real prevention is the vaccine. So any adults 50 years and older get 2 doses of shingles vaccine called Shingrix. It's a recombinant zoster vaccine to prevent shingles. Now, adults 19 years and older who have weakened immune systems because of disease or therapy can also get it because they're at higher risk of getting it. Will it 100% prevent you from getting shingles? No, it will not. I got shingles anyway because I'm under a little bit of stress, and but it lasted about a day. Seriously, I got the papules, never got the blisters, and then it retreated. So I highly, highly recommend it. Let me warn you, though, this vaccine will kick your ass. It will absolutely kick your ass because it made me feel like I had sort of a flu syndrome for about 4 days. But what that told me is it's working, and I could take some naproxen or something.
Did both shots do that to you?
If I remember correctly, the first one was bad, and then the second one wasn't so bad. Yeah, that's a great question, Tace. But anyway, yes, I highly recommend it. It prevents strong protection against shingles and post-herpetic neuralgia. And it's 90% effective at preventing shingles and post-herpetic neuralgia. And immunity stays strong for at least the first 7 years after vaccination. Now, if you have a weakened immune system from chemotherapy or some other, like HIV or something like that, that's active, studies show Shingrix is anywhere from 70 to 90% effective. So it's still effective. You still get it.
Still recommend it.
Okay. Now, let's talk a little bit about shingles again, then we'll get out of here. Can you give shingles to somebody else? Because people will ask that.
Yeah, so exposure to an open blister, right, in an open section of skin, you could can't you theoretically transfer that?
Okay, so
no. Am I thinking about herpes simplex?
Yes.
Okay, sorry guys. Because they won't let you work when you have blisters.
That erases one of your bells. Right. Because you can give chicken pox to someone if you have shingles. You cannot give shingles to someone if you have shingles.
So the virus is transmissible.
Yeah, that is correct. Yeah. That is correct.
It's like a half.
A lot of people ask about that. So, yeah, it's so there are some adults that have never had chicken pox and they never got the vaccine. I used to worry about the varicella vaccine, and I would rail kind of, well, we don't have long-term studies. What if we get a bunch of adults who, when the vaccine's immunity wears away, then now they're going to have all these adult chickenpox cases. And chickenpox in adult is a different syndrome. Just like RSV is a different syndrome for adults, it causes a common cold for the most part. But in children, it can be devastating. And, chickenpox is, they used to have chickenpox parties.
Yeah.
And, but if you're an adult, it really can F you up. So, make you very ill. But it turns out I should have done a little bit more research because it's a live attenuated viral vaccine. And therefore, they should have pretty prolonged immunity to it, if not permanent immunity. So cool. I'm a little happier about that. And I've not seen any adult chickenpox at all. No resurgence of that since Shingrix or the
varicella vaccine.
Varicella vaccine was started. Yeah. Okay. So that's good. That's a good thing. Anyway. All right. Well, listen. Can't thank Dr. Scott because he's not here today. Thanks to.
Too bad.
That's right. Yeah. Thanks to Tacie, and thanks for your topic time and for being here. Tacie's been my partner on air since we kicked everybody out of the studio during COVID. And we just kind of kept it going. I'm glad you're here. Mm-hmm. Obviously, some of the listeners are too. Thanks to everyone who's made the show happen over the years. Listen to our SiriusXM show on the Faction Talk channel, SiriusXM channel 103s, Saturdays at 7 p.m. Eastern, Sunday at 6 p.m. Eastern, on demand, and other times at Paul Ovcharsky's pleasure. And apparently he's doing our show now. I didn't know that. So that's good to know. Paul's a good guy. Many thanks to our listeners whose voicemail and topic ideas make this job very easy. Go to our website at drsteve.com for schedules, podcasts, and other crap. Until next time, check your stupid nuts for lumps. Quit smoking, get off your asses, and get some exercise. We'll see you in 1 week for the next edition of Weird Medicine. Thanks, everybody.